Good morning, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. This morning I would like to share with you about another topic, maybe a little bit away from the first two presenters. I'm going to present about the issues related with the palm oil. Especially on the health issue, which is related with saturated fat and trans fat, and later on the 3 MCBDs, which is heat-produced contaminant, especially present in vegetable oil. And I would like to start with a brief introduction. Why palm oil? It's because, frankly, that Indonesia major export recently is a palm oil, and now is the top one export commodity. And what we are exporting, not only in the form of crude palm oil, which is in the beginning, it's about 50% crude palm oil being exported and refined palm oil of another 50%. But the years ahead, it seems that the portion of export has become less, approximately 20 or 25% in the form of CPO, crude palm oil, and another 70-75% is already in the refined or purified palm oil. Let me start with how the difference between the among vegetable oil in terms of fatty acid compositions. Most of this, what they, usually commonly called as a tropical oil, which is covered with palm oil, and coconut oil is known as having a high saturated fatty acid, or considered to be saturated vegetable oil, can goes up to 80%. And the rest, vegetable oil like the olives, the rapeseed, or the canola, corn oil, sunflower oil, and walnut oil, most of them are unsaturated, which is the saturated fatty acid is only less than 20%, and majority are unsaturated fatty acid, especially the monounsaturated fatty acid. This is the saturated fat coming from the vegetable source, vegetable oil, and saturated fat can also come from the animal source, which is come from the dairy product like butter, and from the meat, and up to the fishery products is getting less and less saturated fatty acid there. Why I respond to the issue on saturated fat, it's because that since in the early 1980s that recommendation has been advocated by the national authority, especially in the US and followed by the UK, that advising their citizens about please reduce the consumption of saturated fat, because if you consume higher amount of saturated fat is associated with the incidence of coronary heart disease. But what happened? The recommendation has been made and followed in the last 25-30 years up to now, and the incidence of coronary heart disease, if the mortality due to coronary heart disease is still going up. So that's mean that the recommendation to stay away from saturated fat is not effectively ended up with the less incidence of coronary heart disease. So they try to reevaluate. It could possibly other reasons that cause the high incidence of coronary heart disease. This means that saturated fat may not the right cause for the incidence. So this is to give you just one examples about the data that coming from the meta-analysis, one of the publications, that what we have here is that the saturated fat is associated with increased change or in LDL cholesterol, which is considered the bad cholesterol is the LDL. And the unsaturated fat, especially the monounsaturated, the MUFA, and the polyunsaturated, the PUFA, is associated with reducing the LDL cholesterol, the effect. But another kind of fat is called trans fatty acid, which is trans monounsaturated, trans MUFA, is associated with increased LDL, even a bit higher than the saturated one. The effect on the good LDL, good cholesterol or the HDL, the saturated fat is not totally bad because saturated fat also has effect on increasing the HDL. And it also occur in the monounsaturated and the polyunsaturated. But for the trans fatty acid, it doesn't have any effect on increasing the HDL. So the overall, if we sum up these two pictures on the left and on the right, the effect of the saturated fat is at best is normal or neutral, no effect. Compared to the monounsaturated is true, monounsaturated is more healthier. But for the trans fat on the most right bar is considered to be the hazardous, as in causing the incidence of heart disease even higher. So it's not quite correct when at the beginning of the 1980s and later on just being realized that saturated fat associated with the coronary heart disease. In fact, the trans fat is the culprit. So, just in the last 2 years probably, there's more and more evidence coming from the publication saying that saturated fat is not as bad for health as previously thought. And it's coming from papers, something like this, that if we have the saturated fat here being protective to the left and saturated fat being harmful, it seems that saturated fat has a neutral effect there. It's not so harmful and it's also not protective. But when we see on the trans fat on harmful effect on the right side, this is from meta-analysis, it looks that many studies has confirmed that it's true trans fat is more harmful, and only one study is that trans fat is protective. So this conclude that it is the trans fat is the problem. So next study is coming in 2016 from Europe that people eating more saturated fat get less heart disease. So this is somehow it's hard to believe for the rest of us, which has been a long time advocated to stay away from saturated fat. I put the point here that the difference between saturated fat from tropical region and from the subtropics. Tropical region saturated fat mostly coming from vegetable source, especially from the vegetable oils. But for the subtropical region, saturated fat are mostly coming from the animal source, mostly milk and meat products. So, although they have the same name, saturated fat, in fact, they are not exactly identical. Yeah. So, if we look at the composition of the diet or food that consumed by most of the, in this case from the European, especially from the Netherlands, that in terms of food groups, most of the saturated fat come from meat and cheese and milk product. It's contribute to more than 50%. And in terms of fatty acid, this is palmitic acid and then stearic acid and myristic acid are the most common saturated fatty acid being consumed. It's also present in palm oil to some extent. So again, that full fat from meat, milk are much better for you. So we just need to see also that the saturated fat from the vegetable oil is also as good as that one. Yeah. This is another meta-analysis saying that the saturated fatty acid effect is not hazardous, it's more protective, and for the monounsaturated, almost the same. Yeah. So, looking at that, some controversy that saturated fat seem to be unhealthy, now it's being reevaluated and being adopted by the national authorities in several countries to revise their recommendation, especially dietary recommendation for their citizens. And palm oil is not all saturated. It's about 50%, 50-50 saturated and unsaturated. Yeah. So what happened with the trans fatty acid? Food and Drug Administration from the Department of Health in the US has put a statement and ban for since ended June 2015 that the partially hydrogenated oil is no longer considered to be safe because the partially hydrogenated oils contains trans fat, and partially hydrogenated oil has been widely used for food ingredient and also for frying medium for deep frying food in subtropical countries. Therefore, in the next 3 years after 2015, there will be complete ban on the use of this PHO. Trans fat has been put into the scrutiny in many nations to make sure that less and less trans fat is being consumed. Trans fat is present in several types of food, in wafers, in chocolate, in bakery, in batter and breaded products, especially when they are formulated or being fried using the partially hydrogenated oil. Yeah. Why they use the partial hydrogenation? Because when they use for frying, if they use the native or the natural vegetable oil like soybean oil or corn oil for frying, it's not suitable because at frying temperature, which is about 160 and 180 degrees centigrade, those oils are already smoked, already burned. So that's why they need to saturate some extent of the unsaturated oil using the process called partially hydrogenation. As a result, during partial hydrogenation, trans fatty acid is being produced. And what trans fatty acids look like, it's similar to the saturated fat in terms of chemical structure. This is the saturated fat on top, the A, all saturated, and on B, one is unsaturated. That makes the difference when during under room temperature, the saturated fat tend to solidify easier than the unsaturated fat, which need a much lower temperature to solidify. But for the trans fat, it's look the same with the saturated fat. So this characteristic of trans fatty acid, which mimics or identical properties with physical properties with the saturated fat. In this case, is palm oil or coconut oil. So, in many countries, especially in Europe, there has been survey to differentiate which product contain trans fat. Most of the products in the supermarket contain trans fat more than 2 grams per 100 gram fat. And this caused a concern that each national authority is trying to reduce this exposure later on. Yeah. So they try to limit by using legislation, maybe mandatory labeling, that each product or food product prepared, formulated using trans fat need to be labeled contain trans fat so that the consumer can be aware of. That way can reduce the intake of trans fat by some consumer group. In some European countries, they already impose some initiative to reduce the intake of trans fat to less than 1% of the calorie intakes, and it's being successful. And now when the people are trying to move from partially hydrogenated oil, it's because being banned, especially in the next 2018 complete ban in the US, not allowed. They need the alternative. The alternative is what I'm going to say, another naturally saturated fat, not industrially hydrogenized oil. So, in terms of performance, palm oil contains high saturated fat without hydrogenation, so contains no trans fatty acid. In terms of availability, palm oil is quite much available right now, and economic in terms of price is very competitive, the price, and in terms of safety, because it contains no trans fatty acid, we consider it safe. Yeah. So palm oil is getting access, increasing in several countries, importing countries, and it seems that some countries are making some resistance to inhibit or to slow down the import of palm oil for that reason, because when they use the reason using the saturated fat is no longer relevant, and using the trans fatty acid even better for palm oil, because palm oil contains no trans fat. So the next challenge is on this what we call the 3-MCBDs. What is this 3-MCBDs and GEs? 3-MCBDs stand for the monochloropropandol, is substance which is produced during the refining of the vegetable oil. And the GE is a glycidyl ester, which is also present during the refining process. So these two heat-induced contaminants during refining has been raised a concern, because this occur or being found in infant formula, in a baby food. So in this case, they have a survey, because infant formula usually formulated using vegetable oils, and among this vegetable oil, it must be contain some palmitic acid. One is because the breast milk fat contain palmitic acid, so the infant formula formulated similar to the breast milk, and the rich source of palmitic acid is palm oil. So although palm oil is being maybe dismayed in many occasions, but for the producer of infant formula, they cannot live they cannot make any formula without palm oil, because they need the palmitic acid source. Okay, and the composition of the infant formula is usually a 25% fat, yeah, in terms of composition. Therefore, palm oil usually part of the mixed vegetable oil being used in the infant formula. Yeah. Only the difference between the fat from the infant, fat from the breast milk and fat from the infant formula, the breast milk fat containing palmitic acid in the two position in the middle, the palmitic acid is in the middle, but in the vegetable fat, vegetable oils, the palmitic acid is under the position 1 and 3. And in terms of contaminant of NCBD and GEs, okay, we still have much, little bit data here I want to share maybe in the next 2 minutes. Palm oil was found to have the highest MCBDs content compared to other vegetable oils. This is also true with another data that palm oil contains a little bit the higher. It's about 10 or about 10 ppm. Yeah. And I put along with this another data from the Udall et al. That MCBDs can be found in the palm oil with different variation, different location resulted in different refined palm oil and contains a different level of MCBDs. So the MCBD content on the palm oil is higher compared to others, and it seems that from different countries the palm oil also contains different level of MCBD. For this reason, we need to do something about modifying and controlling the refining process in such a way so that our refined palm oil product can contain only less than 2 ppm of the MCBDs. I would like to put the last slide about the recommendation that the good palm oil should contain less than 2 ppm of MCBDs, and if for infant formula even much less, and even lower when we use the EU recommendation. For the MCBD is the same and GE is 1 ppm, but for palm oil, when it's intended for infant formula, should contain not more than 0.1 ppm of MCBDs. So this poses quite a challenge for our palm oil industry. We should respond accordingly so that our palm oil export can continue to grow. Thank you very much.